Good.
All right. So I was just introducing that short video that you just watched. Um, the title of this presentation was Questions I Forgot to Ask or Didn't Know Enough to Ask in Optometry School. Of course, that was back in the days when we used a bunch of candles to project the acuity chart. Um, some of the points that Bruce made in that short clip. One, Skeffington held out a holy grail of what optometry and visual training might be. Like the mythical knights of old, Bruce set out on his quest, arranging conditions in testing and training, constantly pursuing the ideal that Skeff said optometry could be. He says that it took him 10 years or more of developing and modifying until it began to look something like what the grail he was seeking. It was not exactly as Skeff presented it, but it was there. And I think that because Steph is enshrined and entombed, um, we tend to think of him as having all of the answers. Um, he had a lot of insight and he had a lot of foresight, but it wasn't always exactly the way it should be or the way it needed to be. He was not really that much of a clinician. He didn't really provide vision therapy, etc. And he relied on people like Bruce and Bob um, to provide that kind of background and information. A second point that Bruce makes is that he did not routinely take FORIA measurements. He states that he'd just never been able to fit them into his routine in a way that it made it worthwhile. And he was well aware of all the various notions about FORIAs and what they were used for, what they indicated, etc. Um, but they didn't easily align with what he was trying to understand about performance. There are probably as many notions about what phorias are and what they tell us as there are about how they should be taken. So this topic has never really been cleaned up. Which brings us to the third point in this brief clip. There are many similar questions lying about that remain unresolved simply because we avoid engaging in the open and often uncomfortable discussions that would be necessary. Now that we've set the table, let's see if we can set out some delicacies. Why do we feel compelled to measure the angle of strabismus? Are we so captivated by the obvious deviation that it is difficult to resist? Can the preoccupation with measuring the angle make it more difficult to understand strabismus? Isn't this the case for ophthalmology, which needed and developed various measuring procedures as the way to plan surgery and evaluate surgical results? Are those our same goals? If convergence is part of next point, if convergence is the coordinated movement of the two eyes toward fixation of the same near point, that's from Dorland's Medical Dictionary, then what is pseudoconvergence? Maybe it's a fictitious movement of the two eyes. For some reason, the tolerance of base out prism has usurped the definition of convergence. Theory predicts that plus lenses will exacerbate a convergence, again by Dorland's definition, insufficiency, because they will move the foria in the exo direction and reduce base out ranges. However, experience suggests that plus lenses often improve convergence even while shifting the foria toward exo and in decreasing base out ranges. This has been labeled a pseudo-convergence insufficiency. It seems to me it would make more sense to maintain the rather obvious and long accepted definition of convergence and label what happens with base out prism as pseudoconvergence, since they are not the same. I'm not always sure that people keep that in mind or understand that moving the eyes to the same near point target is not the same as what happens with base out prism. Actually, the response to base out prism can be described easily as relative convergence, but few seem to use that term. Issue C. Base down prism is said to make a target appear larger and farther away, and base up the opposite. Now, I prearranged with Steve to bring some prisms, and including some dissociating prisms, so you can do this little demonstration there. I don't know if we have time or want to go through the discombobulation of actually doing it while the presentation's going on. Steve's got the lenses and you can see it for yourself. Place some base down prism in front of one eye. With both eyes open, look at an object on the floor 6 to 7 feet in front of you. You should see the object doubled. Sometimes it can take a moment to get things organized. So I think Steve had picked some plates there at the hotel or in the meeting room and put one down on the floor, put the dissociating prisms on, be about 6 to 7 feet, look at the plate on the floor, describe the position of the diplopic images relative to each other. Very typically, it's been running 100% over the years that I've tried this. One is larger and farther away. Note which eye is seeing which target. Now look at an object on the ceiling. Steve said there's some can lights up in the ceiling. They're about the same size as the plate.
Yeah, great. Just so you know what Steve thinks we should do, let you present, talk about this. We'll have our lunch, and then in the 15 or 20 minutes before we come back into formal session, he'll be here setting this up for anybody who wants to participate.
Okay, sounds good. Again, the object should appear double. Note the relative position and size. Now which eye is seeing which target? I don't know whether to go on from there or just wait until people have a chance to do it. But basically, you will see that if the eye with the base down prism, when you look at the object on the floor, it's larger and farther away. But when you look at the object on the ceiling with the same prism, the base down prism, the target will appear closer and smaller. Uh, there's actually ways to do this with only one eye, but that's a different issue. If the demo has been successful, it suggests that the apparent size and distance of the target is not strictly an optical function of the direction of the base. Now, people continue to write, and there was an article not that long ago in the past year or so that again said that base down prism makes things look larger and farther away. And it's just not the case, at least from that demonstration. So there's something that needs more of an explanation. And it's not about the optics of the direction of the base of the prism. It's more a matter of how the field is structured or organized. Another issue, D. I have described an optical prescription as the result of a negotiation between the doctor and the patient. I think it may be necessary to add and their ecology. So too often I am seeing patients who had near point visual difficulties and were treated successfully with the prescription of low plus lenses with or without VT. Many of them are then being told by the same practitioner or another that they should discontinue the use of the near point lenses. I don't understand that. Um, what are the assumptions about the visual process, people, and their ecology that makes this recommendation a logical conclusion? How do you have to be thinking in order to recommend discontinuing the lenses? In a similar vein, a little twisted, I saw an article recently, one of the rags, that we all get, it wasn't Optometry Times, but it was just a step below that, but mostly aimed at practice management and stuff. And it said it was about how practitioners should deal with the grieving that a parent must experience when they are told for the first time that their child needs glasses. That one took me aback. Is this really the way we feel about our lenses? Our ability to use lenses? What are we communicating to the parents? How many funerals are we going to need? Um, Issue E. There are a number of paired terms used to describe characteristics and functions of the visual system. Ambient focal, magnoparvo, dorsal stream, ventral stream, central peripheral, where what? At times, these seem to be used interchangeably. They really are not the same, and we should make better use of them. Make the distinctions more clear, use them consistently. Don't just throw them around because they sound better. But I really wanted to discuss the topographic distinction of central peripheral. What do we really mean when we talk about something like central peripheral organization? I think it can be a useful expression in certain situations and with certain audiences, but is it better suited to a two-dimensional area? What does periphery mean? It's this out here. What does central mean? It's this here, but it's very planar. Tangent screen measures periphery and central, and even the fact that the retina is curved, it's treated in any spot as a plane. Um, does it really do a good job of describing the 3+ dimensional organization of a spatial volume? And I think it's important to get this idea in that we're dealing with a spatial volume and not simply with a two-dimensional plane. As our expressive needs and our audiences develop in sophistication, should we better communicate should we use terms that better communicate our understanding? Hopefully, I've left enough questions. I think that meetings like this, which facilitate your participation, are necessary for our field to develop. Thank you for your time and attention. I cannot tell you how much I miss being there, but I did put together a couple questions. One, what does your Holy Grail look like? And how do you know when you're seeing the whole? That's it. Thank you very much. Are there any questions?